Calgary, Lougheed.
Thank you, Mr. Speaker. Fentanyl killed 272 Albertans last year, and the crisis was so shocking for the Blood Reserve that they declared a state of emergency. And recently, the chief stated, "If someone dies from drugs that you have sold them, we will do everything in our power to hold you legally responsible for your actions." An Albertan who allegedly provided fentanyl to two parents who died, leaving their children orphaned, has been officially charged with manslaughter. To the Justice Minister, what specific steps are you taking to work with the federal Crown to ensure that these types of offences are prosecuted as homicides?
Mr. Justice.
Thank you very much, Mr. Speaker, and to the member for the question. Well, of course, our government is deeply concerned about the fentanyl crisis. We are working in concert with our partners in health to ensure that the supports are necessary to help the vulnerable individuals who can fall into drug addictions, and to ensure that we're making strides on the enforcement piece as well. In terms of the specific case the member mentioned, obviously the federal Crown prosecutors exercise their own discretion, and I'm not able to intervene in that case. But we are absolutely committed as a province to doing our part and making sure we get these drugs off our streets.
Supplemental.
Albertans deserve really good answers on these questions, and I will now ask the Minister of Health. Given that the crisis underlines a serious opioid dependency issue, which the Mental Health Review highlighted in its report, and given that you have identified that an opiate addictions plan for Indigenous peoples is an immediate priority, and given that you've had the Mental Health Review for 3 months, and any delay in implementing this plan is literally a life and death issue, can you please tell us what concrete steps have you taken in the last 100 days to fulfill this recommendation, which is guaranteed to save lives?
Thank you very much, Mr. Speaker, and to the member for the question. As is mentioned, the situation with fentanyl is tragic, and it's not just something that's happening in Alberta. This is something that many provinces are dealing with right now. And one of the things I'm very proud of is that we've shown leadership in making sure that we get naloxone kits, the antidote to this opioid, into the hands of communities and individuals, as well as paramedics, EMTs, nurses, psychiatric nurses. We're increasing access so that a life-saving initiative can be taken here. In terms of the Indigenous Advisory Committee, that's certainly a very high priority for us. My Deputy Minister has that on the top of his list, and I'll be happy to provide some further follow-up with the member opposite about success that we're having there.
Thank you. Second supplemental.
Thank you, Minister. And finally, to the new Minister of Indigenous Relations, given that your government failed to mention anything about effectively dealing with the fentanyl crisis and how it affects Indigenous Albertans in the throne speech, and given that your government has chopped $13 million from addictions treatment, and given that a number of reserves, such as the Blood Tribe, have established successful frameworks for dealing with the fentanyl crisis, what real-life strategies are you adopting, adapting, and delivering for the safety of Indigenous individuals and communities on and off reserves?
Thank you, Mr. Speaker, and thank you to the member for the question. We have been working very closely with the members of the Blood Tribe and, of course, with Indigenous communities across this province to work on significant issues with regard to addictions and, in this case, fentanyl. We have increased public awareness through a variety of programs. We have increased the use of availability of Naxalon to be available for treating people who have taken an overdose, and of course we are ensuring treatment is available and doing all of that in consultation with the Indigenous community through our fentanyl response team. Thank you.